I'm Dr. Gabala, consultant interventional cardiology and head of cardiology department in MB Hospital in Nairobi, Kenya. So today we're going to talk about heart failure, a little bit information, and a little bit glimpse of what can we do to prevent the development of heart disease in general. So, cardiovascular disease, it refers to a group of disease that affect the heart and the blood vessel. So, cardio means heart, vascular means blood vessel. So, cardiovascular disease is a group of disease actually, and it is more pronounced in the Western world and in Europe, US, but recently it came to the Kenyan population, which have change the lifestyle a little bit more like any other European country, which means lack of activity and more smoking. We will talk about that. So if we talk only about Kenya, is about 25% of the hospital admission in Kenya. It is because of cardiovascular disease, and 13% of all death in Kenya during the last year were due to cardiovascular disease. So it is a big problem, and we have to actually tackle that problem from different aspects. The best way, of course, is to prevent the development of cardiovascular disease. We know that hypertension is very common in Kenya. It affects even the foreigners who lived in Kenya, and I think people and most of the scientists believe that it could have something to do with the height and the altitude. So hypertension I would say, affect between 40 up to 60% of the population, but unfortunately they don't know that until they come for something else and they measure the blood pressure by the doctor or in the hospital, and then we find out that it is elevated. So to prevent the cardiovascular disease, we have to prevent the development of the cardiovascular disease by treating hypertension on time. Hypertension is difficult to treat except if the patient actually take his medication. The problem with hypertension, it is a disease which doesn't give any symptoms. So the patient might need one or two or three drugs to control his blood pressure. At the same time, he doesn't have any symptoms. So you can stop the drug at any time and he will not feel any difference. Once he start to have symptoms of high blood pressure, it's too late and it is symptoms of complication. So that's one thing. The other thing that we can actually stop is to treat the diabetes in a better way, which means that we have to have a good control over the diet, over the food we eat, to prevent any high blood sugar or high cholesterol. Cholesterol is another problem in Kenya because of the fatty food, because of the ordering outside that scrap food that we can get from different companies. And the worst thing that some restaurants they use the oil many times to fry the food, and then they made the hydrocarbon, and the hydrocarbon is very dangerous to our body. It can affect the blood vessels. It will cause narrowing of the blood vessels going to the heart or to the brain, and it will cause heart attack or stroke. So we have to eat healthy. We have to increase the vegetables, the green salad, fruits. All these things are good for even diabetes and for the cholesterol. So to have a healthy diet is very, very important. If you have or if you don't have heart disease, you still have to try to have a healthy diet. Smoking is the worst things, and it actually, apart from destructing the finance and the economy of the family, but actually it causes a tremendous amount of disease. I'm not talking about cancer lung because it's very common, but I'm talking about heart disease. If you smoke, it will definitely affect the heart disease and it will affect the prognosis. We found out even for those who have a blocked arteries and we open with stent, those who smokes, they actually die quicker and they have more complications compared to the non-smoker. So smoking is very easy thing to stop. It is not like narcotics, and it can be easily stopped without any even doctor input. The weight. Overweight is actually affecting a large number of population in Kenya. We have to be aware of our weight, and we have to start to look at our weight and to take measures to lower it by medicine or by just eating properly, doing enough activity, and in some cases operation might even help to do a laparoscopic operation to just decrease the weight. Is very common and it's actually working very well. Proper sleep, of course, important for heart disease. Heart disease and heart attack always happen early morning when we wake up. And that's because of the hormones and because of the nature that early in the morning there's a lot of adrenaline, a lot of cortisol, which wakes us up. And this can be a very big burden to the heart. But then coming to the heart failure again. So heart failure, the definition of heart failure actually to start with is inability of the heart to pump the blood to the whole body and inability to get rid of extra fluids. So once the heart goes into heart failure, so it's unable to contract and it will lead to stagnation of the fluids in the body.